Hi, okay, so today we've got ourselves some head and neck models. We've also got a skull over here. All of these are showing these blue lines, which is what we're going to be studying. And these blue lines are the dural venous sinuses. So before we begin, we need to know that what exactly is the dural venous sinus, right? Or what are the dural venous sinuses? As the name suggests, dural, that has something to do with the dura mater. Venous sinuses. So these are just spaces that are going to be draining blood, and these spaces are going to be found where, or these veins are going to be found where? They're going to be found between the dura mater, right? What do they do? We know that veins, they drain blood. In this case, these sinuses, they drain the blood and the CSF from the brain. They also drain the blood from the scalp, and they also drain the blood from some part of the face. So they're draining blood from three things: from the scalp by some connecting veins. They are called the emissary and the diploic veins. Then we've got the blood draining from the cerebrum and the brain itself. And then we have some part of the face that is also being drained into these sinuses. Okay, as the name suggests, that the dural venous sinuses, these are found between the layers of the dura mater. We know there are three meninges. One of them is called the dura mater, the outermost layer. It has two further layers. It has an endosteal layer that's going to be closer to the skull. Then there's going to be a meningeal layer that's going to be closer to the brain itself. So in between these two layers, we would have these blue lines, that is the dural venous sinuses. And they are different from the CSF and from the arteries because they are found in the subarachnoid space, whereas this venous system, dural venous sinuses, these are going to be found between the dural mater. So you need to know the difference. Another thing that you need to know is that these veins, this entire system is going to be ultimately draining into the internal jugular vein. These are some of the things that are asked of the students at times regarding dural venous sinuses. So we have these three models over here. We're going to exclude this one because one, it's a little dirty from all the markings that the students do, even though we tell them not to. But the thing is that these two are exactly the same. So we're going to set these apart, and we're going to do the cleaner one, and we're going to be doing this one because it's a little different from this one, and students tend to get confused in the markings over here. So we're going to start with the easier one first, and we're only going to be doing identification, right? It's just for OSPI. Okay, another thing that you need to know is that which of these dural venous sinuses are paired and which are unpaired. That's usually, or that's commonly asked from the students. The first dural venous sinus that we have over here on both the sides, that means this is going to be paired because it's at the junction where the sphenoid bone starts. This is the sphenoid bone, and then it goes all the way, or it touches, if you might want to say, it touches the parietal bone as well. That's going to be covering, right? So this is going to be the sphenoparietal sinus on both the sides. After that, we have this sinus over here. This is going to be called the superior petrosal sinus because it's going to be in the petrous part of the temporal bone that is over here. This is the temporal bone. So this is going to be the superior petrosal sinus again on both the sides. So that means this is also a paired sinus. After that, even though we can't see it on this model, there's a sinus that is in light blue over here, that's traversing over here or going from here to here. So this entire sinus, again on both the sides, over here it's even less visible. So this sinus is going to be the inferior petrosal sinus. So superior petrosal and then inferior petrosal. Okay, don't confuse this sinus, this being the inferior petrosal, with the sinus over here. This is a different sinus which we're going to cover in a bit. So we've done three so far. So we've done this one, sphenoparietal. We've done this one, superior petrosal, on both the sides. Then again on both the sides, this light bluish colored. So this is going to be the inferior petrosal. After that, we have this sinus over here, this sinus. So it's a little confusing because it's a continuation of the inferior petrosal and the superior petrosal. So this sinus over here, this is called the transverse sinus. And it's also given another name. It's also called the lateral sinus, which you can, guess why is it called the lateral sinus? Because it's spreading laterally. From the center point, it's spreading laterally on both the sides. So this is again a paired sinus. Transverse sinuses, superior petrosal, inferior petrosal. Okay. Now, this transverse sinus, it further extends or it forms a sinus that is going towards the foramen over here. That is going to be the jugular foramen. This sinus over here, because it's roughly of an S shape, this is called the sigmoid sinus. So we have again a paired sinus. So this and this, these are the sigmoid sinuses on both the sides. So again, not to confuse the sigmoid sinus over here with this sinus over here, this is the inferior petrosal. After that, we have this center point where most of the sinuses, they drain or they converge. So this corresponds to a structure called the confluence of sinuses. This is going to be the confluence of sinuses, where most of the sinuses, they collectively drain before they drain further into the transverse sinus, ultimately into sigmoid sinus, and then ultimately into the internal jugular vein through the jugular foramen. Okay, so confluence of sinus. There's another sinus that you can see over here, right? That's coming from somewhere above. So this sinus is the superior sagittal sinus. This sinus, it starts from over here, foramen cecum, and then it covers the calvaria or the cranium, and then it comes over here, and it also drains into the confluence of sinus. That superior sagittal sinus can be seen over here. So now you can relate that if I were to put this skull or this cranium or calvaria over here, so this blue line is going to be the superior sagittal sinus. Okay. So again, just to quickly recap: sphenoparietal, superior petrosal, inferior petrosal, confluence of sinuses, transverse or lateral sinuses, sigmoid sinuses on both the sides, again paired. Then we have this sinus over here, and it's sensibly named because this sinus, it closely adheres to the occipital part of the cranium or the occipital bone. This sinus is the occipital sinus. Not to confuse it with another sinus, which is the straight sinus that we cannot see over here, because that straight sinus, it's like this in the tentorium cerebelli. That's just a sheet of dura mater that separates the cerebrum from the cerebellum below. So in between that layer or junction, we have the straight sinus. But over here, we have the occipital sinus. After that, we have this sinus over here that is closely related to the foramen magnum. That's over here. Okay, we can see the spinal cord, right? So this is the foramen magnum. Because it closely adheres or it closely surrounds the margins of the foramen magnum, this sinus is given the name of marginal sinus. Okay, so we've done most of it. We can also see this sinus over here. Okay, this is the anterior intercavernous sinus. And because there's an anterior intercavernous sinus, there's also a posterior intercavernous sinus, which we cannot see on this model. So anterior intercavernous sinus, then we have this cavernous sinus, again, which is not really visible, but it's on the lateral side. So we can't see the cavernous sinus over here. You can see this empty space because it's not shown over here. Over here, they've shown the cavernous sinus. So sphenoparietal, superior petrosal, inferior petrosal, sigmoid sinus, again sigmoid sinus, sagittal sinus coming from above, confluence of sinuses, transverse sinuses, occipital sinus, and marginal sinus. Okay, so we've done this model. There's also an inferior sagittal sinus that is unpaired, as you could have guessed that the superior sagittal is also unpaired because it's singular. So the inferior sagittal sinus, we can't see it over here because it's present in the free margin of the falx cerebri. Okay, quickly coming over to this model. Again, it's similar. The only difference is that they have one extra feature or one extra dural venous sinus that's not shown on the other models. So quickly recapping, which one should this be? Yes, sphenoparietal. This is going to be anterior intracavernous sinus, and you can also see just below this, it's posterior intracavernous. Then we have on the lateral side, this is going to be the cavernous sinus itself. After that, we have this one and this one on both the sides. So this is going to be the superior petrosal, very good. We also have this one. So this is going to be the inferior petrosal on both the sides. Then we have this thick S-shaped sinus on both the sides. This is the sigmoid sinus that's going towards the jugular foramen, that's over here. Then we have this structure over here, this structure. So you can see that there's an elongation, right? It's not really a confluence. The confluence is over here. It corresponds to the internal occipital protuberance, right? So this structure is going to be the confluence of sinuses. This is the superior sagittal sinus that is coming from above. This is the right transverse sinus. This is the left transverse sinus that they've labeled as B over here. Now, if you look closely, so if this is the confluence of sinus, okay, then the thing that we have over here, this thing that is splitting, this is the occipital sinus. So they've shown the occipital sinus over here to split, which rarely ever does. So that's just a difference in some people that might be found, that the occipital sinus, it can tend to split into two. So people were confused, the students were really confused at which sinus was this one. So this is the occipital sinus. Now, you would be thinking that, wait, shouldn't this be the marginal sinus? But it's actually not. If you see the foramen magnum, you can see that they have this blue line over here, right? This blue line. This is actually the marginal sinus, as you can see over here. So this is the marginal sinus, but this one is the occipital sinus. Again, there's no straight sinus because it's going to be like this. The extra sinus that we have over here is this one. So this is just the basilar venous plexus or the basilar venous sinuses. But we hardly ask this from the students. So that was it about the dural venous sinuses. Hopefully the models were clear and you could see the differences and be able to identify them if they were asked from you in your OSPE or in your Viva. Okay? And there's no such important thing. Another thing that you should remember is the contents of the cavernous sinus. That's usually asked in a lot of things, PCQs, SCQs, OSPE, Viva. But we're not going to cover that in this one. Okay? One more thing that I would like to add, a very important point, is that the cavernous sinus over here that we can see, the cavernous sinus, this entire structure, right, the anterior intercavernous sinus and the cavernous sinuses. So the cavernous sinus, it drains blood from nose area or the face area that's often referred to as the danger area. So this structure over here, this is the danger area, okay? Because any infection from over here or from the face, it can spread through the veins into the cavernous sinus, because most of these veins over here that are going to be draining this area, they drain into the cavernous sinus. One of those veins is the superior ophthalmic vein, and it is this vein that participates in the cavernous sinus thrombosis. So that's when the infection of the face, it spreads into the cavernous sinus, and it's very, very life-threatening, and it's very fatal. So superior ophthalmic vein, do keep that in mind, because that's usually asked at how the infection from the face, it can spread to the cavernous sinus. It's mainly via the superior ophthalmic vein. Sometimes it can also spread through the inferior ophthalmic veins, That's also one of the tributaries of the cavernous sinus, but the answer and the main vein that participates in this is the superior ophthalmic vein. So that is it. All the best.